Hi, this is Dr. Ken Rictor. Today we're going to talk about post-nasal drip, sinus drainage, snot. We all know what it is and we know how irritating it becomes. There are so many over-the-counter remedies that are designed to give relief of this mucus drainage. So where do we start? Well, we must first understand that mucus is good, it's not bad. The drainage catches bad bugs and irritants that have invaded our system and keeps them away from more vital areas. Now, there is a huge list of causes for excessive sinus drainage. Allergies, dry air, dehydration, sinus infections, colds, flu, changes in the weather. So what can be done? Well, there's natural remedies. Aromatherapy with peppermint or eucalyptus can alleviate the problem. Steam therapy. This thins the mucus that's draining, and you can get enough steam with a shower or purchase a steaming unit that's designed to provide a concentrated amount of steam to the head and face. Nasal irrigation. Now, nasal irrigators are devices that clean out the nose and sinuses and can counteract the effects of dry air. Neti pots, very popular and effective. Saline sprays are also very, very good. Humidifiers. Keeping the air moist becomes a necessity when the winter air comes around. This added fluid in the air will help thin the mucus so you can drain the mucus and it's not as irritating. Elevating the head. Just a change in position can help alleviate the mucus drainage and prevent congestion. So, medical treatments. What do we do? How do we come in? Well, decongestants can help loosen the mucus, but also used with caution because they can elevate your blood pressure and can cause some urinary retention. Non-sedating antihistamines, Zyrtec, Allegra, Claritin, are useful treating the underlying cause of the sinus congestion. Viruses, common colds, can cause an abundance of mucus. Now, there's no great treatments to kill those viruses, so we have to depend on our own immune system to fight off that virus. Now, influenza, flu, can cause many symptoms of drainage and mucus, and there are anti-flu medications available if treated within the first 2 to 3 days of the symptoms. Bacteria can also be a culprit of sinus congestion and sinusitis, but usually results in very thick drainage and symptoms of pressure and pain. Now, antibiotics are needed to help with this and help the body get rid of that drainage. Allergies can cause this as well, and if there is preventative allergy treatment, then take the meds or go through immunosuppressive therapy, which will be helping in eliminating the allergy cause. So what's the take-home lesson? First, you got to make sure your environment is humidified and not dry. Cover your face when you go out in cold air. Make sure you stay hydrated. Go ahead and humidify your house. Second, use remedies, as mentioned, to help with the mucus. Third, watch for complications. Watch for fever, prolonged symptoms, difficulty breathing. And if any of these things pop up or you don't feel comfortable, then by all means contact your primary care physician for definitive evaluation and treatment. Now, most of these conditions are more irritating, but they can lead to some problems like sinusitis. They can lead to bronchitis. They can lead to a lot of things where the mucus is not cleared adequately enough. I wish I had one remedy for everything, but I'll tell you what, if you want to know what medicine does not know how to treat, count the number of medications there are to treat it. All you have to do is go down the counter in your drugstore and see how many medications there are for cough, cold, flu, sinus congestion, and you'll realize we're trying, but we're not there yet. This is Dr. Ken Rictor with your Curbside Consult.